you see a young lady, childbearing age, that suddenly cannot have a baby and is extremely sick with this disease and is on one of these pumps to help them live, you realize just, man, you think, can't we cure it? What I did in the last 40 minutes to give you an overview is just that. It's an overview. It's a foundation from which you can grow your own tree, grow your own garden. You can decide which one of those areas you might want on a Sunday afternoon. Just go, hey, what's new on treatment? What's this genetic thing that Garcia mentioned? What about the complications? How do I use these new vasodilators with this pump that we mentioned? And others that are on the horizon. There's a lot of research. I'm sure you've all received literature where they have a whole weekend dedicated to pulmonary hypertension. It starts on a Friday and you're going, God, can there be that much? Yes. All you have to do is start reading up on it. There's a lot of interest in it because it's not cured. And those of us who are dedicated to trying to help our patients live with the disease and relieve pain and suffering, this is one of the really most devastating diseases that a patient can have. Because how do I follow it? Can I do a right arc every time a patient comes in? I can do an ICG and get a good idea as to what the resistance is. I can do a 2D echo to give you some idea as to what the pulmonary blood pressure is. But is this perfect? Are other things that can make that TR worse? Yeah. And I'm completely dependent on my technician to get right into the jet. So suppose he doesn't get quite right into the jet, or he doesn't take another view, substernal, short axis, long axis, foreview, reverse it, really work it. Or maybe he has to do something unusual. I mean, these are things that go through your mind as you're looking at that, that the text saying, looks like we have pulmonary hypertension, and then this thing comes up to you and you go, man, I sure hope he did that 2D echo, right? Or she, whoever it is that did, I hope they did it right. Because once you make that diagnosis, especially with electronic health medical records, that's devastating. It's an awful disease to have. I'm going to open up for questions. What you have with you is a very short article, Pulmonary Hypertension, from the Texas Heart Journal, Heart Institute Journal, where I trained. The article was published June, that was last month. I just received this last month. And when I got it, I thought it might be good to review that, the estrogen paradox. It helps animals, but not humans. And the other one was from the Cleveland Clinic. I just got this weekend. I thought you all might enjoy something really, really interesting where everybody's pushing these new anticoagulants. And you've heard that people are getting on, the Sunday morning talk shows talking about this because they're obviously paid consultants to push this. And those of us in private practice who've seen as the young lady or a young man or even an elderly gentleman and see these bleeds because you can't get it out. There's no reversing it. And this other thing of using renal dialysis, it's only in the latitude, not a Pradaxa. So it carries some risk. Any questions? Now, I want to thank you. Before I forget, I want to thank you for staying awake. Yes, ma'am.
Which pulmonary function studies were you referring to that help to identify pulmonary hypertension?
The standard pulmonary test that we do, the inspirometry and so
just
forth.
FRC and SPC?
Exactly.
Not your DLCOs or
lung volumes? I don't think they're going to help you. I think the key thing that's going to help you is get some idea of what's going on there. But it'll help you determine whether you're dealing with secondary causes of blood pressure, such as COPD and so forth, emphysema, whatever. The minute you see the COPD or emphysema, then you start thinking, how much overlay does pulmonary hypertension have in the patient's symptoms? You see what I'm saying?
How much normal area of the arteries are there with the aging process, senile emphysema and so forth? Or is that a loaded question?
It does not happen to the elderly gentleman.
Thank you.
Only if you're having symptoms do I start worrying. Clearly, I'm not, no, that's a good question. I mean, it's kind of like the first time I started reading Harrison's Internal Medicine as a medical student. There's Tom Garcia reading. Oh my God, I got leukemia. Oh my God, I got cancer. Oh my God, I have migraines. Oh, now I know why I can't get along with my wife. Oh, I'm going, wait a minute, I can't have them all. You know? So you have to use a little common sense as you're dealing with your symptoms. Remember, you're dealing about your patient's symptoms. And by the way, if any of you start having symptoms, are you going to treat yourself? No. You're going to see a doctor to help you make the correct diagnosis, so that way your treatment and lifestyle adjustments are appropriate. But by the way, is it smart to keep your weight down? Is it smart to eat right? Is this information available to everybody? And how many people do it? Everybody ready for a little run? Okay, everybody stand up. Stand up. Spread your legs. Deep breath. Exhale. One more time. And one more time. Straight up. Now lean over to the right. Lean over to the left.
My other right.
Yeah.
And give yourselves a hand. Thank you very much.